Okay, this is the video for the ABO blood typing lab. What we have are samples for each unknown subject, sample 1, sample 2, sample 3, and sample 4. Each well will be exposed to anti-A anti-serum, anti-B anti-serum, and then anti-RH. Your objective is to determine each subject's blood type. So, if exposing subject number 1 to anti-A antibodies, if coagulation occurs for anti-A in the well marked A, that will indicate that A antigens are present. If coagulation or clumping occurs in well B, that will indicate that B antigens are present. If coagulation occurs in well RH, that will indicate that RH antigens are present. So what you are going to do is observe for coagulation in each well. Based on that, you will be able to determine which antigens are present, and you will be able to determine the blood type for each of the unknown subjects. Okay, these ladies are going to add the RH. Please add. So you're adding RH. And now we're going to add anti-A and anti-B. Can you stir your RH wells for me, please? And if we don't see anything right away, we're going to add a couple of more drops, which I'm going to go ahead and start adding a little more RH to these. So what we're looking for is crystallization, clumps, change in color. All of those things would be an indicator of the presence of the antigens. You're going to tell me. Okay, we are back with the results. We don't see any coagulation. We did see some slight color change, but we're going to take that as no change at all based on comparing to the other results. So no coagulation at all for Mr. Brown. For subject 2, green, we have coagulation in well A, if you can see that. Those little crystals there. Thank you. For subject 3, for Jones, we have coagulation in well B only. It's thick and clumpy for well B. And then for Smith, I think Mrs. Smith, we have coagulation in well A, and we have coagulation in the RH well. When determining your final results, please note some blood types may repeat. Take into consideration that whenever the antigen is present, that determines the blood type. That's including RH. If the RH antigen is present, that blood is then deemed positive for RH. If the RH antigen is absent, then that blood is negative or negative for RH. So these are the results. Coagulation means that the antigens are present. One more time. We're saying that no coagulation has occurred for subject number 1. For subject number 2, coagulation has occurred in well A. And for subject 3, coagulation has occurred in B. And for our last subject, coagulation has occurred in the A and the RH well.